Harihi Om. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheswara, Guru Sakshat Parabrahma Tasmai Sri Gurave Namaha. Namaskaram, Master. Gnananandamayam Devam Nirmala Spatika Krutim Adharam Sarva Vidyanam Hayagriva Mupasmahe Hayagriva 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 Etiyo Vadet Tasya Nisarate Vani Jannaganya Prabhahavatu Om Shanti Shanti Shanti. My pranams to my master, Master E.K., and the legends of homeopathy, Dr. Samuel Hahnemann, Dr. Kent, and other homeopathy gurus. And my pranams to Dr. Chalpati Garu, and my pranams to Dr. P.V.S. Satyanarayana Garu, who has given me this opportunity. Today, we will have question answer session, and if time permits, we will go for details into the miasms. The question answer itself is on miasms. And I am very much thankful to Dr. Hanumaya Garu. In fact, why there are no questions? Very less number of questions are asked. Why? Because Dr. Hanumaya Garu has given such a clear introduction and also the details of the miasms so clearly, crystal clear. He is a scientist by profession, and he has shown his talent in prescribing and describing the miasms. Even a common man could understand the way Dr. Hanumaya explained it. Hence, there are no many questions. Only a very small number of questions are there. That too, these questions are also, in fact, answered by Dr. Hanumaya during his class. The routine doubts what generally the students get, only such questions are asked. And the questions of previous classes also, little more explanation in no source. One Srimati Jayanti, she has asked that question. Then somebody asked me to give actual cases and treatment for all the three miasms. Then the constitution of a person and miasm, is there any difference? This question is also already answered. Now, I find it difficult to explain the questions because the only reason is all the questions are asked in the same way. But however, I am ready to explain the miasms in a different way. As our master has put it, Master E.K. and Master M.K. has given a different dimension to the miasms. I am going to introduce those points to the members of the group. And to answer these questions also, no source already we have given sufficient explanation because each no source we have taken a separate class. So you please go through the videos again, you will understand it better. And little explanation means a no source is the medicine prepared from the diseased substance of the person. So that will cure the symptoms of that disease problems. And symptoms are always important. You select a no source or you select a constitutional remedy. The underlying very important principle is the totality of symptoms, that you always remember. And forgetting the totality, questions have come. I told you in the first class, the January, I told that. Even after 6 months, you will ask the same question because here also one person has asked the question. I will tell you that question. The need medicine for asthma, suffering for the last 25 years using inhaler. This question, even it will be asked after 2 years of our coaching also. I don't know whether this person has attended our previous classes or not, but this is a very common question. In homeopathy, please remember, note down. If Sanjeev sir is available, please note down. There are no medicines in the name of the disease. There are no medicines in the name of the organs. The medicines are for the person, but not for the disease. Because if you give medicine to disease, the person may have to stop taking food and take only medicines. Because so many symptoms are there, so many diseases are there. According to allopathy, each symptom is taken as a disease. So in that case, when symptoms are taken as diseases, how many medicines we have to give? That is being done in allopathy right now. And this was done even during Hahnemann's time. And Hahnemann could establish the theory of homeopathy because he thought that in future, next centuries, people may have to take only medicines but no food. Present situation is like that. A person suffering from acute kidney problem and also diabetes and also this ulcer or something like that, he cannot take salt, he cannot take sugar, he cannot take kara, and he should not take water also too much. That is the situation. So in homeopathy, no medicines in the name of the disease. The person who is suffering from asthma for the last 25 years, let him present himself before a classical homeopathy doctor. Then they will take down the case based on the symptoms. A medicine will be selected and he can be cured if the lungs are not damaged beyond certain stage. If they are damaged beyond irreparable condition, it is there means it is difficult for us to cure him. So this is one of the very important point one has to understand. The idea of the homeopathy itself, very clearly you have to tell whoever asks the question of any disease, this is only because of the influence of allopathy. We are asking medicines in the name of diseases or in the name of the organs, which is not correct. According to homeopathy, there are no diseases at all. There are only sick people, but there are no diseases. This is clearly stated by Dr. Hahnemann, Dr. Kent, and other homeo doctors who are practicing the classical system. And what is classical system? There is some doubt. I will answer that question also when I come to that doubt. Now we will start one by one. So, actual cases you asked. We have treated thousands of cases. Thousands. You take any case, suppose sulfur, an example you will take. A person suffering from the symptoms of sulfur. We select sulfur only to that person who is having symptoms of sulfur. So we select the medicine based on the symptoms of the person. This you remember. For nux, you give nux. For sulfur, you give sulfur. We have treated hundreds of cases with sulfur. That means a sora miasm, because sulfur is called the king of sora. So the symptoms of sulfur are present in a person. Give sulfur in a systematic way, in ascending. You asked about potency and also this repetition, etc. That depends upon each and every case. The potency and the repetition depends upon the case, individual case. That depends upon the sensibility of the person, his response to the medicine that is given. One person responds within few minutes, another person few days, another person few weeks. Same medicine, we have to wait. The response, complete response. He may respond to a little extent. He may come and tell in the follow-up visit after 15 days, he may come and say, sir, a little better, maybe 5% or 10%, that's all. That is, his response is very poor. Even if he reports 10%, you need not repeat the medicine because the medicine has already started working in him. Because of his insensitivity, he might not have got good relief or complete relief. Does not matter. Wait. Even he need not repeat. You have to repeat only when there is the stall, that is, the cure is stalled or the further improvement is not there, then we may have to repeat. So I told you, petition. Once he put the petition, we gave the medicine, and he should again put the repetition. Again he should file the petition, that is repetition, and in that case only drug can be repeated. This point, please make it sure that you understand this point well. This is the basic point. So definitely you should not ask for a medicine for a disease. That is very, very important. So these actual cases, there are many cases are there. I can quote hundreds, but let us concentrate more on this question answers and also the miasms. Hanumaya Garu, after his explanation of miasms, I find there is no room at all. That is what we say. We generally in our meetings we say that the cow has grazed the entire land. There is nothing to eat for me. Completely has cleared all the doubts. 8 classes, remember it, not a joke, 1.5 hours each. He spoke for 12 hours. Very clearly, he has told about all the miasms. However, I just put it in a different angle, a different dimension. I would like to give as Master MK has put it. Every nature itself, the person has 5 koshas. Call it as Annamaya kosha, Pranamaya kosha, Manomaya kosha, Vijnanamaya kosha, and Anandamaya kosha. These are the 5 koshas. We call it as Pancha koshas. Every person has all these 5. That means Annamaya kosha is the physical body. That's what we are doing. The Pranamaya kosha is the prana. The Manomaya kosha is the mind. And the Vijnanamaya kosha is the willpower. And Anandamaya kosha is the bliss. A right medicine is selected. The person will be in the Anandamaya kosha. If a right medicine is selected, how are you? If you ask the patient says, sir, I am fine. How much fine? Lot of fine. Fine means not the penalty. Here fine refers to he is so happy. He is in a blissful state. There the Ananda is the one, the ultimate. This is told in our Bhruguvalli of Taittiriya Upanishad. The Varuna is the son of Bhrugu, and the Varuna comes to the father and asks, Father, please tell me what is Brahman. Then the father replies that you go and know it for yourself. You do tapas, and then you will know what is Brahman. Then he goes to the tapas. And when he starts tapas, he will get the answer from within himself. Then he comes and father asks, have you found out what is Brahman? Yes. Annam brahme divya janat annadhyeva khalbimani bhutani jayante annena jatani jivanti annam prayam cha visham vishantiti tadvignaya punareva varunam pitaram upasasara. He says annam is the Brahman. Now also we use annam parabrahma swarupam. We don't throw the rice or whatever we eat, the food. We don't. Because annam brahmeti vyajanat annadhyeva kalvimani bhutani jayante. Because of the annam, that is because of annam only all the living creatures, beings, they are taking birth from annam. Here annam refers to the prithvi also. And they are sustained, they are able to live only because of the rice or the food, and they go into the food. So I thought the Brahman is nothing but annam. Then he says, no, this is not the correct answer. Go back and do tapas again. That is the father. A father will not give the answer so easily. He says, you know it for yourself. Now we have workbooks, we have got the guides, everything. Answers are written first and then questions. So our education system is so bad because our education system always comes with an answer. The student has no chance to probe or investigate or try to know what it is. We are giving A for apple, B for bat, C for cat. That is not the systematic education system. The student must be asked to find out what is A and what is for A. Then he will tell, one boy will come and tell apple, another boy will come and tell ass, another boy will come and tell some other answer. So they probe, they investigate, hence the brain grows. Otherwise, present education system, even in 10th class, they do some copying, they pass, they come out with degrees, BTech, MTech, even PhD, with no knowledge. Because we are not giving an opportunity to learn. So then the Bhrugu asks the son Varuna, you go and do tapas again. He went there. Then he got the answer from inside. Prano brahme divya janat, pranadhyeva khalvimani bhutani jayante, pranena jatani jivanti, pranam prayam cha bhisham visantiti, tadvignaya, punareva varunam vidaram abhasasara. He comes to father again and he says, sorry papa, I thought it is annam. But if annam is there, even if annam is there, the person cannot survive without prana. So prana is the Brahman. Then father says, go and do it again, papas. Third time. He goes there. Then he does again. Then he says, Mano brahme divya janat, manasa heva khalvimani bhutani jayante, manasa jatani jivanti, mana prayam cha visham visantiti, tadvignaya, punareva varunam vedara bhavasasara. He says, even if prana is there, even if annam is there, the person will not have, the survival will not be there clearly, because the purpose of the life cannot be fulfilled as told in verse number 9. So he says, manas is required. So by manas only one is surviving. He says manas is so important. Then father says, go and do it again. Then he will go there to the forest and he will do tapas again. Vijnanam brahme divya janat. Even if mind is there, if it does not know the logical conclusions and logical thinking of the mind, a person who is mad and insane, he cannot think properly. Rational thinking is not there. So there is no use of having a body. There is no use of having prana. There is no use of having mind also, unless vijnanam is there. So he says, vijnanam brahmeti vijanat. Again, father says, no, that is not the answer. He knows the answer. Bhrugu knows the answer, but he will not tell to the son Varuna. Says, go and do tapas again. Then he goes there and he does again. And he comes. Anando brahme divya janat. Ananda jeva kalvimani bhutani jayante. Anandena jatani jivanti. Anandam prayancha visham visantiti. Saishabha argavi varuni vidya. That is called Bhrugu Vidya or Varuni Vidya, because Varuna and the Bhrugu. It is named after them. That is a blissful state. When if it's a scientist having so much knowledge, having so much money, everything is there, but Ananda is not there. No health. You understand? This is the homeopathy was discussed in our Vedas and Puranas. So the blissful state that is required. And a medicine, proper medicine is given to the person. A person reaches the state of blissfulness. There he stays with him. A person gets some disease, some complaint. Suppose he gets a problem like kneecap pain. He comes down to the kneecap. He stays in the kneecap and he will tell all the persons that my brain is here. And the learned doctor gives injection to this kneecap. But the pain is here and medicine is given to the kneecap. See the fun of allopathy. But in homeopathy, when he says kneecap is there, we will go to the head. We will go to the central nervous system and we will say why it is required. So this is the one very important. So we should understand this very clearly, and it should make it a point that we have to give the medicine to the person, but not to the disease. This is very important. So you please understand this, and then you can give the answer. So this is Ananda state, that is the blissful state, that is the healthy state, that must be achieved. So what is miasm? Now miasm can be defined in two ways. One way, it is called the cause of the disease or the cause of the generation of symptoms. And another definition given for miasm is the susceptibility of the individual to the disease or to the external situations. That is called miasm. So once a miasm is present in the person, any triggering cause from outside makes him sick. And the sickness again is given by set of symptoms. Those symptoms will direct us to a particular constitutional remedy or the totality of the symptoms. And that medicine, if given properly in right potency and right repetition, the person will be relieved of the complaints and he will be happy or the healthy. But suppose after giving the constitutional medicine also, the person gets back the disease or the symptoms come back again with the constitutional remedy, then we have to find out to what miasm this person belongs to and the symptoms he is expressing, they belong to which miasm. And then that miasm, if you can select properly and give a medicine particularly to that miasm, the symptoms and patient will be cured permanently. So if without miasm, the patient will not be getting disease. The susceptibility to the disease will not be there. When there is miasm, susceptibility to the disease is there. So the constitution of the person is the constitutional medicine, will give totality of the symptoms, and the miasm is a deep lying disease cause, that is the susceptibility to the disease, that is called the miasm. So miasm is only a disease cause in an abstract state where the person will not be able to see the disease cause. I gave one example in one Guppedu Manasu. I gave Telugu commentary, and Dr. PVS sir asked me to give English version to that. I am going to tell tomorrow or day after tomorrow. I will explain it in English. In that I gave, there is a cause of the problem. The cause is removed, then disease symptoms will go. An example I will tell you. A person is walking on the road. Suppose he puts his leg on a thorn and thorn is piercing into the foot. Then pain will be there as long as the thorn is not removed. The thorn is to be removed and apply some oil or something soothing. Then the pain will be disappearing. Same is the case with a fractured leg. Unless the bone is set back to the normal state, the pain continues. After putting the bone right position, then we will put a POP, plaster of Paris, so that we make it immobile, because that has to join on its own. And it will take some 3 weeks or 4 weeks or 5 weeks, depending upon the injury. Till that time, that particular organ should be made immobile. So we put POP. But till the bone is set into right direction, the pain continues. Once the bone is put into right direction, pain decreases. Same is the case. Here we have to understand that a miasm is a state of mind or state of the person, that there is one disease cause which is present in latent state, which is not visible to the microscope, which is not visible to the most powerful instruments that are available, even MRI or any scan or for PET scan or any scan. These scans and everything, our master used to say, they are all post-mortem methods. After doing the test, blood test, they say that the person is having some sugar or is having some ulcer, something. But the patient is a patient for last so many years. There was no machine to detect the disease cause, because which is in a very subtle state, very, very subtle state, because it is the mind. And recently I got one case. Their daughter-in-law and mother-in-law fight. The daughter-in-law says, I will not go to the house till my mother-in-law dies. The cause is the mother-in-law, she says. And mother-in-law is also not happy with this girl. She says, let her not come. I am happy with myself. Both are happy with themselves, but both put together, each one becomes the cause of the problem to the other. In fact, both need homeopathy treatment. Many people do not understand this. A symptom which is odd, which is not in order, which is not according to the nature, it is called a disease. You know, Ignatius, Lecasis, they drink solids, they eat solids easily, they swallow it, but they cannot drink water, liquids. What is this? A person who can gulp a solid, can't they take water? They say that, yeah, I cannot. Throat pain. So odd is a symptom. Anything odd behavior, odd dialogues, odd way of doing things, that is all symptoms. Symptom. And they have a miasm. And the basic miasm is Sora. That's already Sir has explained very clearly. So I will try to answer the remaining questions also. And possible remedies for patients with surgical interventions like pacemaker or intraocular lens, etc. Again, I repeat the same answer. For surgery, after surgery, there are no medicines for after surgery cases. If at all, we can give staphylococcus or hypericum or arnica for the temporary relief, or acetic acid for anesthetic problems. The anesthesia is more, or any problem arising out of the intake of anesthesia, acetic acid 30, 1 or 2 doses will work. But for any particular remedy, for pacemaker or intraocular lens or something, surgical intervention, there is no particular remedy for that. Remedy is available based on only totality of symptoms. Please remember this very clearly. The one person has come with IOL and asks medicine, we may give hypericum because small nerves are punctured. Or we may go for physostigma or some other medicine concerned with eye, but not on the name of this surgical intervention and other things. There are no medicines in homeopathy. Remember this very clear. Very clearly I am telling. We have been telling. We will be going on telling that. This is the basic principle one must register in one's mind. If you don't understand this basic principle, further you cannot construct any more stories on the building. You have to make the foundation strong. Then only you can build 3 floors or 4 floors or 5 floors. This is important. Then how to know fibroids, stones in kidney, gallbladder, etc. without scanning? Yeah, scanning has come in the recent past. But these problems are there in the beginning also. The patient comes out with the symptoms. Based on the symptoms, if you select medicine, the stone also will be either thrown out or will be made to pieces and it is sent through urinary bladder or something. Symptoms. Suppose gallstone bladder symptoms stones are there. Then he will get vomiting. He will get pain in right epigastrium region and he will get some kind of vertigo, giddiness. So what are the symptoms? Based on the symptoms, you can definitely, if you are a senior doctor, having seen so many cases, you can observe and you can learn. All patients need not get the same symptoms. Remember this. We are under the wrong impression that same symptoms appear in all patients. No. So based on the symptoms, we can come to know. Suppose fibroids are there. There will be stomach pain. There will be, for ladies, there will be bleeding, clots and bleeding. Then menstrual cycle, irregular cycle. Then continuous protracted bleeding is there. All these are because of the fibroids. Then you can go for scanning once you know it. For homeopathy, the scanning and other physical tests may not help much, but it will help because we will come to know what is the size of the stone and whether we can cure it or not. We can definitely know. All the pathological tests, they help homeopathy also. Don't say that I am homeopath, I don't want any pathology, nothing. That is wrong. You should know anatomy, you should know physiology, you should know pathology. Then you are a complete doctor. More than these 3, you should know the person. Without knowing person, you know only scanning report is there. So I have gone through the scanning report and I give medicine based on scanning report. You will be utter failure because you are not touching the person. you are touching only the disease. So touch means not like touching the person. Find out the qualities of the individual who has come for treatment. Suppose they come and say, sir, there are stones in the gallbladder. Okay, no problem. You tell me your symptoms. What are your symptoms? My symptoms, I get giddiness, I get vomitings, I get pain, I get a lot of discomfort, irritability, etc., 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 etc. Not based on the totality of the symptoms, you select a medicine. Automatically, this is the result. Dr. Hahnemann calls it as the resultant of the disease. A diabetes is the resultant of the disease cause present because of the miasm, sora, syphilis, or psychosis, or 1 or 2 or 3 or 4, the disease comes. So when you treat the person as a whole, then automatically the miasm is driven out or it is sent out and patient gets back the health. And the cure, to make it a permanent cure, what you have to do is remember very well that the lifestyle of the person should be normal. The food habits should be taught. A patient who comes again and again with the same symptoms, find out his food habits, find out his style of living, then makes necessary corrections, give medicine again, the cure will be permanent, and the permanency is claimed only in homeopathy. Can say that permanent patient can be brought back to the health because we are setting right the person himself, but not one organ or but not one disease symptoms. This must be remembered very well. So, how to know the fibroids? By knowing the symptoms of the patient, by asking the patient the symptoms. Forget about these names. Give the medicine. If that is the right medicine, fibroids also can be melted inside. It is possible. Then Dr. Rogini, she asked a question. When young, they are soric and develop psychotic miasm after 15 years. In between, they are okay. What is this? Dr. Anmaya sir has clearly told about this. There is only one miasm in the beginning, sora. Because of this sora, the desire, itching that comes, and entire the disease will be sent out on the outermost layer because the person wants to stay more time in this house. He doesn't want to go out. Even on the death bed also, one struggles for life because we have developed such an affection on this body. We are attached to this body. We feel that we are this body. One best example I will tell you. Just one person has purchased a new car worth some 1 crore or 2 crores. Some we know we have foreign cars. And while coming to the house, there is a scratch, there is some minor accident, or while putting the car into the gate has he just struck with the gate and there is a scratch. In Bangalore or Hyderabad, there will be no car without dent. So what will be the position of the person who purchased the car for 2 crores? What will you think? He becomes the car. He is the car. And a scratch on the car door is a scratch on his skin. He feels so bad, because he identifies himself with the car. Same is the case with us. So there is only one sora in the beginning. It is not becoming psychotic, becoming syphilitic, then all the psychosyphilis again become tubercular, then they come back to sora. No. In the beginning there is sora. What is sora? Sora is the desire. So when the Adam and Eve in the first creation, according to the Bible, the first creation, the God asks them not to pluck a fruit of that particular tree. Then Satan comes in the form of a snake and it says that you do it. What is this? He has given the birth to us and he has given these fruits and everything. What were they are there? He will tell like that, don't worry, you eat. So first time a disobedience to the order of the parents. That is the sora. That is he wants to do something which is not to be done, a desire to do something against. That is the beginning of the Sora, and 99.99 to the power of 99 are having Sora. You tell me, where do we find that one person? That is told in Bhagavad Gita also. Manushyanam sahasreshu kaschit etati siddhata etatamapi siddhanam kaschin mam vetti tattvataha. Use the word sahasra means large number is called sahasra. So in thousands of people you will find one person who will try to know me. Kaschit yatati siddhaye. He tries to do it. Yatatamapi siddhanam. The persons who try like that. In that again lakhs and lakhs of people. One person kaschin mam vetti tattvataha. He will come to know me. My nature. So you tell me, where do we stay? So only a person without the Sora, without syphilis psychosis, he will only can understand what is God, and he will only, that is what he told in crores of people, there may be one person. That question is also there. I will answer further. So here, the person turning from Sora to psychosis, nothing is there. He will get psychotic symptoms, he will get syphilitic symptoms, depend upon his lifestyle. Suppose he took birth only as a Sora, then he got a desire to have extramarital relation, or he goes to do some debauching, then he will connect himself with the gonorrhea, then he will suppress that gonorrhea, and then he will get the syphilis, then psychosis, etc. So the beginning is Sora only. So in the meanwhile, with Sora might have taken birth, then doing bad things, he will become psychotic, syphilitic. But Sora also will be there. Sora will not go and then syphilis come. No, they are called intertwined miasms. It is possible that after 15 years, he also gets the symptoms of psychotic miasm and also the syphilitic miasm. And you have to find out a medicine based on the totality of symptoms which can remove all the three miasms. Remember, this is very, very important. There are medicines like calcaricum, sulfur, lyco. They can work on all the three miasms. All the three will be removed. So, in between he is okay, he is not okay. Because he has good resistance power, the susceptibility is not there. But that miasm is in a dormant state, in a latent state. Given a chance, it will open its 1,000-hooded cobra. That is what Sora is compared with a 1,000-headed or 1,000-hood cobra. Anytime it will catch. The Satan in the Bible referred also is like that. This is very, very important. Then, some Krishna sir has asked, all the polycrust medicines have three miasms. Yes, almost all polycrusts have worked for all the three miasms. Here also I would like to make it very clear to you. Do not try to remove the miasm. First give a constitutional remedy. Because if it is a polycrust remedy, it will also cure the patient and also remove the miasm. In case the symptoms recur again and again and again, there you may have to go for a nosode to attain the complete cure. Then like a tuberculum or sorinum or syphilis, depending upon the symptoms. Even those symptoms should tally with the symptoms of the patient. Miasmatic symptoms also should be tallied. That is very, very important. So this is the answer. He has given an example. Sora is prominent, but acid nitricum cannot be used in antipsychotic. Remember one point very, very clear. I repeat again and again. Maybe it is boring, I am not bothered. You should understand first. All the three of us, Dr. Satyanarayana Garu, Hanumaya Garu, or myself, we are striving our best to make the subject understand by the candidate, the student. If you don't understand, all our efforts are waste. We are trying to give maximum number of examples, maximum number of cases, only with the reason that you should understand what it is. And after Hanumayagari classes, a clear thought is given for miasms. I am only brushing it. I am using the same thing. Don't think it as a repetition. It is only make you more clarity, to give more clarity to you. So this is the answer. Okay. If aciniticum can be used, is asking Krishna sir, aciniticum can be used when the patient has aciniticum symptoms. Any drug you can use when those symptoms are present in the person. This is the cardinal principle you should never forget. Without symptoms, never give medicine. Dissimilar symptoms, don't give medicine. Similar symptoms, similia similibus curantur. Those symptoms the person is having, same symptoms are available in the medicine I selected. That is called a similar remedy. If that is given, patient will be cured permanently. Subject to, again, a condition that he must maintain the lifestyle, food habits, etc. according to the nature, naturally. No artificial thing. That is very important. Next. Under what circumstances no source are to be considered or other over the other anti-miasmatic remedies? I repeat, when the symptoms are present, suppose carcinosinum symptoms are there, and there is history of carcinoma or cancer in the family, you can give carcinosin for that. Suppose the tuberculosis symptoms are there, cough, cold, fever, etc., etc. You may have given a constitutional remedy, getting cured, but again it is coming back. Then you may have to go for a drug, a medicine, tuberculinum or bacillinum, like that, depending upon the symptoms, modalities, all are important. So a medicine will be selected, even a miasmatic medicine will be selected based on the symptoms of the patient. So no source can be considered after using anti-miasmatic remedy if the symptoms recur again and again. There is no meaning of continuing with the same medicine. Then you can verify again the symptoms, read the symptoms, then whether they tally with either carcinosinum or tuberculum or bacillum, etc. Then give that medicine. The patient is permanently cured. This you must remember. This is the basic principle. Next, Sitaramaya Garu, he has asked one question. Is the central theme of each medicine physical, mental, or emotional symptoms to assess? Yes, central theme is clearly told by Dr. Hanumaya Garu. The miasmatic medicine and miasm cause. You have to understand the patient symptoms and the medicine symptoms. If they tally with each other, assessment of symptoms is very, very important. The totality of the symptoms is the keynote of classical homeopathy. If you don't understand the totality of the symptoms, you will never be able to select a right remedy. And if you select a very deep acting remedy, which will also work as anti-miasmatic remedy, still the symptoms are coming back again and again, then take down the case, because some symptoms will definitely cured by the anti-miasmatic remedy. Some symptoms remain or only few symptoms come back. In that case, you have to give anti-miasmatic remedy or directly no sword can be given. This is the rule of homeo treatment. Next question. Patients 7 generations, how to count, will not be knowing above the 3rd generation. Yeah, this is what our elders say. Even if we give our boy to some other girl as marriage and then bring another lady or girl to our house as a daughter-in-law, we have to see 7 generations. How do we know? Even 3rd generation nowadays, even the grandfather name also many people are forgetting. Great grandfather, if he is able to tell, is well brought up, very well brought up by the parents. Then great grandfather's father, that is grandfather's grandfather. If you are able to identify him, you are a divine person, great person. Because nowadays Nobody remembers when father name. It's a very great thing if you remember. 7 generations. How do we know? By symptoms. An infertility symptom has come. In spite of the good health of the both boy and girl, they are not able to get a child. Conception is not coming. That itself is a symptom that in 7 generations there is something wrong with some of the persons. And how to avoid before marriage? Very difficult. But you can avoid with the help of the astrology. So astrology can tell whether the match can be fixed or not, match fixing. So we take the help of astrology in such cases. So we cannot control, we will not know more than third generation or fourth generation. We can only see the health of the individual. If both are healthy, then we can see any other symptoms are there. By noting down the symptoms, we can give the medicine. And infertility is one of the symptoms which we will come to know only after marriage. For that, there are medicines. Like generally infertility cases, generally there will be a syphilitic miasm more present in such cases. So we will give one medicine based on the totality of the symptoms, and miasmatically we go for syphilum in 1 potency, 1 or 2 doses with a long interval of 4 to 5 months. After 4 months or 3 months, you can repeat one more dose of syphilinum if conception has not come. I have given medicines to many people where they conceived also. Syphilinum, but syphilinum is to be given preferably on the 5th day of the menstruation, and the same day both husband and wife should take 1 dose of syphilinum. Symptoms will be present. Infertility itself is a symptom. With dullness will be there. And what are the symptoms of the syphilis origin? Sir has told very clearly. So those symptoms are present, then you can give 1 dose. So 7 generations, this is the story. Next, Phytolocca is useful for tonsillitis. Some Lakshmi madam, she asked me this. I am tired of giving the same answer, whether the person is having Phytolocca symptoms or not. Tonsillitis is only one symptom. Beretta-Carr works, Beretta-Muir works, sulfur works, Nux works, Pulse works for tonsillitis. Why Phytolocca? Even in acute case also, find out the acute totality. If you want to give Phytolocca to a patient, whether the patient is having Phytolocca symptoms. If you want to give Beretta-Carr, whether the patient is having Beretta-Carr symptoms. Tonsillitis is only one symptom, external symptom that too. What about the mind? What about the moods of the patient? What about his response to the questions or his behavior, his character, etc., etc., etc. Always remember, select a medicine based on more mind symptoms than on physical symptoms. Physical symptoms is not at all important for us. Important. I cannot say not at all. Sorry, I amend the statement, not at all. They are important, but most important are the mind symptoms. So forgetting the mind, if you want to give medicine, you are a failure. So for this, my answer is Dhanalakshmi. Somebody asked for this question. My answer is, if the patient is having Phytolocca symptoms, give Phytolocca, tonsillitis will be cured. That is the answer for that question. Then, need medicine for asthma, I told you, suffering from for the last 25 years. That is the answer for that. Difference between psychotic depression and syphilitic depression. Sir has told, Harmaya sir has told. What are the symptoms of the psychosis? What are the symptoms of the syphilitic miasm? In the syphilitic miasm, you will find the symptoms of dullness, that cranky behavior, everything is there. He wants all sour substances. Mind, what are the mind symptoms? Syphilitic symptoms, you know. Psychotic symptoms, you know. Depression is common for both. So The difference between syphilitic miasm and psychotic miasm, if you know the symptoms at the mind level or highest level, depression is one of the symptoms. So please read, go through the notes that is given by Dr. Hanumaya Garu, then you will understand it better. Definitely you can understand it. There is nothing, I'll tell you, it's not Brahma Vidya. Till we know it is Brahma Vidya, once you know it, it is Kusu Vidya. In Kannada, Kusu means a small thing, small boy, baby. Otherwise, it is Brahma Vidya. So read, listen again and again. You will understand the miasm well. Then Sri Dr. V.S. Raju Garu, as a thought delayed baby, delayed baby may be having psoric miasm. If it is looking for help from outside, it is syphilitic miasm. Don't go by one symptom. Looking help for outside is one symptom. But a person who is delayed for many things, delayed milestones, delayed growth, delayed bone growth, delayed teeth growth, everything, delay. Delay is the keynote for syphilis. Cunning is the keynote for psychosis. Remember this very well. Because here also, you cannot say that one point of delayed, you cannot take it as psychotic. He may be having a psoric, he may be having psora and also syphilis. And possibility is there, he may also have psychosis. And which is prominent? Next, one more question is there, then that we can answer that. So, just like selecting a medicine based on the totality of symptoms, even miasm also, you should take down the total and find out the central theme. Everything will have a central theme. Central theme, psora is very speed, high speed. And syphilis is slow. And psychosis is manipulative or cunning. This you should remember very well. Because this is the important point you should always remember. I will tell you, syphilis first is dull, oppression, anxiety at night, restless, mental spells. Patient is driven out of bed, inducing symptoms of suicide. Most of the persons who commit suicide, they belong to the syphilitic miasm. Aggravated by perspiration. All symptoms are worse at night. Mentally dull, heavy, stupidity. Syphilitic patient is a stupid patient. That means his logical center is not working properly. Dull, I told in the beginning. And especially stubborn, very stubborn. Suspicious. Suspicion is there in a psychosis also. There are common symptoms in all the three miasms. Like there are common drugs for all the three miasms. I told you in calcarea or sulfur. Sulfur works for all the three miasms. Like that, there are some common symptoms. Suspicion you take. That is there in syphilis, that is there in psora, that is there in psychosis also. In a different dimension, different angle, different degree, you can say. Not angle. Different degree it is there. Depressed, but keep troubles to themselves and sulk over them. He will not express himself out. They become melancholy and condemn themselves. That is why they commit suicide. They condemn themselves. Why this is happening like this? I am a fool, he will say. Sora will put the blame on others. He is very aggressive. So the latest to syphilitic is dull, stupid, heavy, and obstinate. The children who are very obstinate, depressed, and the patient keeps his depression to himself. The first thing you know is that he wants to commit suicide. This is the syphilitic miasm symptoms. Take Sora. He is quick, active, prostrated easily from mental exertions or impressions. Heat of whole body after mental impression. Anxious, filled with forebodings, fear of death or of illness, or that their case is hopeless, incurable, mental depression. That is there for Sora, that is there for syphilis, that is there for psychosis also. So, what are the other symptoms? They think that their case is hopeless, incurable. Timidity, Sora patient is timid, with a sense of fatigue, vanishing of thoughts while reading or writing, cannot control thoughts because his mind is running at 100 kilometer speed. Sora. The Sora people only play more games, video games, and other things. The syphilitic people will not prefer to use their mind in a very fast way. Nowadays, you see the children, even 2 years, 3 years old, they play video games. Sora. Sora with the tubercular miasm, intertwined miasm. In some cases, there are 2 or 3 miasms intertwined with each other, they are present. The present day children, most of the children who are overactive, hyperactive, ADHD, all these people, they belong to Sora plus tuberculosis. That is why we have to select medicine, Sora plus tuberculosis. Both the symptoms are there in one miasmatic medicine. That is a medicine which works both for Sora and syphilis, that is tuberculosis. The present day, the small children, they will respond very well. I gave tuberculum to many ADHD patients, many. No eye contact. They jump, play. At a very high speed running, Sora, that is, and tuberculum. I gave them tuberculum in 1 single dose. I have not repeated. The parents are so happy that now he is balanced, sir. One mother asked me, sir, if you give medicine to control the activity or activity, will he become dull? That is what she asked. She is afraid of that, naturally, child. I told, homeopathy will never make anything either dull or active. It will only balance. If it is more, it reduces. If it is less, it increases. But sees that the person attains a state of balancing nature. He can balance. He will not become this or that. He is neither overactive nor dull, but he becomes normal. We call it as normal temperament. That is what Master CVV has given a prayer he calls normal temperament. Not too hot, not too cold. So this is how we have to treat the autism patients, ADHD patients, all those patients. And remember, there are autism cases, they belong to all the 4 miasms. In them, there may be a syphilitic miasm, there may be Sora miasm, there may be psychotic, there may be tubercular, 1 or 2 or 3 or 4. It is inheritance. Whether the parents give property or not, we are not aware, but they certainly give a disease. That is inheritance, getting in many cases. So just I am reading because these symptoms, I wanted to make it clear to you. And how the Hahnemann could find out these miasms because of his constant practice. And the people are coming back again and again and again. In spite of selecting the best remedy, the cases are not getting cured. Then he found out that there is a disease cause which is present in a very latent condition in the person unless that cause is removed and the patient is becoming susceptible to the disease because of the cause which is there, that he named it as a miasm. And when he found out, he has started doing research on this. He found the Sora, first miasm is Sora. From Sora, because of the illegal contacts or doing bad things, they get syphilis and then psychosis and tuberculosis. All the remaining three are the outcome of SORA. SORA is the first basic miasm because of which the entire humanity is becoming sick. So we will continue in the next week. My pronouns to Dr. P.V. Satyanarayana Garu. He asked me to take 1 or 2 classes. Definitely next Wednesday we will continue this. And my thanks to my master E.K. and all the masters. My special pronouns to Dr. V. Hanumaya Garu, who has given a wonderful, wonderful explanation on miasms, which is very difficult. Because why homeopathy to teach it is difficult? We are talking about something which cannot be seen, which cannot be shown. We are talking on such an abstract subject, and persons like Dr. P.V.S. Garu and Hanumaya Garu can tell very well, very easily. We can understand. My thanks to Hanumaya Garu and all of you. Thank you very much. We will meet again next Wednesday. Thank you.